Next, we talk about Hoffa fat pad syndrome. As we all know, it is also known as infrapatellar fat pad. Now, what exactly is a Hoffa fat pad? It is one of a fatty soft tissue that lies under the patella in front of the knee. It is a highly vascularized structure. It is richly innervated, hence it is highly sensitive structure to be impinged or to be irritated. That's where when we have a repeated micro trauma due to overload or compression or overuse, there is an irritation and inflammation that triggers the knee pain. The anterior infrapatellar area is basically the location where the person feels a lot of pain. Now, especially when a person does hyperextension, it usually results from repeated pinching of the exterior part of the fat pad between cartilage of the lateral facet of trochlea and the lateral patellofemoral ligament. Understand that any pathology that reduces the spaces between these two structures might encourage the local impingement. It is also seen that direct trauma is often the culprit. A person had a hard fall on their knee or in a sports collision or they got a direct blow to the front of the knee. All these can trigger acute inflammation in the fat pad. We said overuse. Now, overuse injuries develop gradually. If you've recently increased your training intensity or started a new sport or even begun exercising after a period of inactivity, the repetitive stress that comes in can irritate the fat pad over a period of time. Now, one more thing is knee instability. See, we've seen that knee instability creates a domino effect. How? For example, the person has an ACL injury. Now that doesn't just affect the ligament, it also reduces your overall knee stability, making the fat pad more vulnerable to getting pinched or compressed during the movements. It is also seen after a surgery. Usually an instrument that is being used during the surgery can irritate the fat pad during the surgery itself. It is commonly seen in younger women, that too the dancers, the jumpers, sports players. Once there is impingement, there is an edema, there is then fibrosis formation. Later on, chronically, we can see ossification. It is seen that knee flexion eases symptoms in these people. That is, these people don't like knee extension. Why? The logic is simple. The fat pad gets compressed when the leg is in extension. Thereby, that lesser space in between, closer the joint, there is collapse in the fat pad due to that smaller space. Knee extension fully often triggers the discomfort, as does standing in one place for an extended period of time. Many find that squatting down or even walking downstairs become increasingly uncomfortable. Why this Hoffa fat pad syndrome could have occurred is also due to the kinetic chain again. It could be due to the tighter IT band, higher patella height, the larger distance between tibial tuberosity and the trochlear groove, increased trochlear angle. People who also have had repetitive falls can lead to hypertrophy of the muscles. It is often left undiagnosed. Person might have come with an history of osteoarthritic knee or a ligament or meniscal injury or any sort of surgery related to knee or any injury to the knee. Alright, they might have gotten this Hoffa fat pad syndrome, which usually shows up as anterior knee pain. Hence why it could have been undiagnosed. Hence why the treatment protocol of an anterior knee pain goes into a different tangent. Thereby this gradually keeps on getting fibrosis and ossification done, which is why people a lot of times has to undergo a surgery for the removal of the fat pad. Now how do we diagnose this is by merely observing. Observation plays a major role. See, these people will have a lot of swelling. They'll have a swelling in the infrapatellar area, which is very evident. It could also be with a lump at times. And on palpation, usually it is sore, it is very firm, and we can perform patella glides, superior, inferior, medial, lateral, and all the other. We can ask them to do range of motion, that is squatting especially, or activities such as kneeling, standing, walking, and adduction sitting, that will tense the IT band. And an MRI shows the swelling of the Hoffa fat pad very easily. There is this Hoffa's test that can also help in understanding if the person has Hoffa fat pad syndrome. We ask the person to lie down in supine with flexing the knee at 30 degrees. Now we palpate with our thumb either on the lateral or the medial side at the fat pad. While palpating, we maintain that pressure by the thumb over the fat pad passively, then we extend the knee. If the person has painful reaction to it, then the test is called positive. And that's how easily we can understand that person is having a Hoffa fat pad syndrome. What all treatment can be done is, again, icing is very important in these people to reduce the swelling. They can use insoles that lift up the heels, especially, hence why these people like heels. Posture education, gait re-education has to be done. If a person has femoral internal rotation more evident, then that's where these will help. We can go for dry needling, we can go for taping. Now the goal of taping is to tilt the inferior portion of the patella anteriorly to reduce the impingement and the subsequent inflammation of the infrapatellar area. Next, we can go for strengthening, especially the closed chain exercises has to be focused, targeting the quadriceps, especially the vastus medialis oblique, to improve the patella tracking. Then resistance training for our glute medius is very important, especially the posterior fibers. It will help in reducing the hips internal rotation and the resultant valgus force at the knee. All these will align the patella in the trochlea better way. Then stretching can be done, especially the anterior hip structures, to increase available external rotation if the patient has that internal rotated femur.